Hi, everyone. Welcome to the Curated Caregiver with me, Donna Jackson, the Adult Caregivers Coach. And today we are having a conversation with Dr. Elita Wyckoff. Hi, Dr. Elita. How are you?
Hi, how are you? I'm doing well.
Great, great. So, guys, one of the things that I am very serious about doing is bringing experts in front of you who will address any area of caregiving that you are going to encounter or potentially encounter on your journeys. So today, Dr. Elita, tell our guest what your expertise is in, and then I will introduce the topic.
Sure. My name is Dr. Elita Wyckoff. I'm a board certified OBGYN here in North Carolina. I have been a practicing OBGYN for 19 years now, and I am a member of the Menopause Society.
Very great. Very nice. Thank you so much. And so, guys, that's what we're talking about today. Um, the effects of menopause as the caregiver, how we cover that, take care of our loved ones who might be postmenopausal, still menopausal, as well as ourselves as we age and get to this stage of life. And so, Dr. Elita, I want to just start off with some kind of overall questions addressing specifically that elderly woman that we're caring for. So how would you say we treat the vagina, the urethra, the anus, cervix when our loved ones need adult diapers? What comes into play there? What things should we be looking for, and how we care for them with their sexual health while they're in? And when I say adult diapers, I mean not just once in a while, but that they're actually in them constantly.
Yeah, thank you for that question. So, for from the perspective of a gynecologist, the cleaner the area is, the better. So, hygiene is at the forefront, especially when there's some type of um, not necessarily sanitary padding, but any type of protective garment that stays against the body for long periods of time. So for these women, it's imperative that they are clean, the vagina, the external genitalia, so the lips of the vagina per se, the vaginal opening, the perianal area is cleaned daily with soap and water, and dried thoroughly. And then those diapers per se, or those any type of covering to protect against the urinary loss or incontinence, or whether that's fecal or urinary, should be changed on a consistent basis, a regular basis, not, twice a day. It really needs to be a lot more consistent, because that moisture just kind of lays up against the genitalia and invites more infection and inflammatory changes. So that is paramount. First is the hygiene component. Um, I would definitely avoid consistent use of antibacterial soaps, because that is the tendency. Oh, there must be an infection there. There's odor there. There's discharge there. Let me just use antibacterial soaps from now on. And the concern with consistent antibacterial soap use is that the bacterial flora that does develop at that area will then become resistant to antibiotic use in the future. And then there will be infections that are much more virulent and cause problems later on, treatment-wise. So here and there, intermittent antibacterial soap use, may be beneficial, but definitely not on a consistent daily basis. Just regular soap and water without a lot of preservative perfumes that can be incorporated in a lot of the products now. And then secondarily, I would definitely say some type of emollient on the not necessarily the genitalia, but the external genitalia, the labia. So whether that is a type of, we used to have Vaseline, now there's Aquaphor, butt paste. There, if you think of
A&D ointment.
right,
Yeah.
yes.
Yeah.
And so you think of these products and you think, oh, it's a 65-year-old, 80-year-old woman that is bedridden. There must be special products, when really just think of them as caring for a baby's bottom that's in diapers constantly. You want to change them frequently. You want to keep that person clean, and just prevent any source of infection.
Yes. Oh, thank you. So comprehensive. That was one of the things you mentioned was, keeping the area dry from urine specifically. I wanted to kind of drill down there.
Yes.
What do you know about those devices that wick away the urine and they're external? And I'm thinking of this in terms of, if they are in the diapers all day, is there a possibility that at night they can kind of have that area aired out a little bit more, so that maybe these types of devices, and I don't know if they really work well, but it's external to the body and they are supposed to wick away some of all of the urine, and then give the area a break so it can get air and breathe through the night. Yeah.
So I would say I'm not as familiar with those devices in particular. There are products available that describe themselves as more wicking away and kind of soaking up the fluid in a more advantageous way versus a diaper or padding, almost like menstrual panties. Let's give it,
Okay.
for an example. Anytime there is a break from the moisture is beneficial.
Okay.
The question is whether these devices would, in other ways, increase the risk of infection at those areas. So
Yes.
that becomes a factor as well, because if there's urine loss, that may mean that there is also more of an anatomic factor in the risk of infection, because these postmenopausal women have a different type of anatomy that increases urinary tract infections. So there are several layers to just using a device per se at night.
Yes. Okay. That makes total sense. And staying here just for a couple more questions. How prevalent would yeast infections be in women of this age range, in conjunction with using, the diapers or even their diet,
I would say very prevalent. We can many times almost categorize these types of infection as yeast, or starting out as yeast, or secondary infections of yeast, because it is initiated from the moisture and then the development of the yeast, and then the breakdown of the skin and the inflammatory changes. So whether it's redness, whether it's peeling, whether it's breaks or cracks or lacerations of the skin, it can all stem from or root from a type of yeast infection. what people call a diaper rash, and all of these different terms that we use. So it is very prevalent, and the goal is to prevent versus having to treat after the fact, because usually if there is a substantial infection there due to yeast, it is much more difficult to treat because there is a superficial component that is external, and then likely there may be a more systemic and throughout the body um, um, presence as well. And treatment may be needed on both fronts. And of
Mhm.
course, that can be more difficult with aged women who have multiple medical conditions. And these medications, of course,
Yeah.
have the potential for side effects.
Yeah. Yeah. You hit everything that I was thinking, you know, taking antibiotics, a course of antibiotics for a certain amount of time, trying to balance that with maybe eating some yogurt or different things that can level that out.
Mhm.
But having that constant presence of the barrier of the diaper and the plastic and not airing out. But let me just make sure I heard you correctly. So a diaper rash is also a form of yeast?
It can be, yes,
Oh,
yes. And a
okay.
lot of times what we may see is a dermatitis, which is an infection of the skin. So whether that infection of the skin is due to the yeast or a break in skin and it's more bacterial,
Mhm.
sometimes they can present the same.
Got it.
So we just have to think about it that way. A lot of times, more commonly, the yeast is the component that we see most
Yeah.
often. Bacterial infections usually lead from a break in the skin that then has insulted the skin. So it starts from a local area and spreads.
Yeah.
So primarily, we will address as if yeast is present first clinically.
Mhm.
So it's
Okay.
it's very important to acknowledge too that with the care of these women, if they are on substantial antibiotics, they are more prone towards yeast infections.
Mm.
And then it becomes, how can we combat that? And sometimes it's not as simple as, dietary changes like yogurt. Sometimes it's more substantial, like probiotics
Mm.
and more of an antifungal treatment for more of a long-term therapy.
Mhm. Mhm. Yeah, thank you. Uh, so okay, last one here, and this one is gonna probably be a little shocking, but we're hearing more and more about grandmothers contracting STDs, right?
Yes.
What do you think is contributing to this trend?
Well, it's not really a trend. I think as gynecologists, we have been very well aware of this for a long time, to be
Oh,
honest with you,
wow.
because in these different areas where there are a community of women and men over 55, 60, 65, they are friendly, engaging with each other, and usually not with one partner. And as a result, there is a substantial risk and rising of sexually transmitted infections. And that varies from, gonorrhea, chlamydia, trichomonas, especially, and even in some degrees, in some situations and areas, HIV, because a lot of these mature adults feel like they can't
Mhm.
get pregnant. So there's not a restriction as far as how frequent and who their partners can be. And there's not a widespread um, evaluation system usually in place in some of these communities.
Yeah.
So it allows it to
Oh,
flourish,
wow.
so to speak.
Well, listen, wow. This is all right. So we all of these segments are insightful, right? But I often thought when I started to hear this, when you said it's not a trend, but when I started to hear about this thing, right, for
Mhm.
seniors, I thought it was with the aging baby boomers,
Mhm.
because of, you know, the not, I guess it was the hippie movement or the flower movement or whatever, and
Mhm.
everybody was this free love kind of thing, and they just kind of carried that through their lives. So they just had that lens about their sexuality. So it just didn't change. Um,
Yeah,
I
that's definitely one factor. And do you think that this is their community? And some of these communities are large, and they are staying active,
yeah,
and maybe have lost a partner that is not there. And so this has allowed both men and women to continue to have joy at that stage of their lives. So,
yeah,
I say that to say that as someone that is either caring for an elderly family member or going to visit them at a community, whether they live by themselves or with other people, um, sexually transmitted infections is something that should be evaluated for an active woman.
yeah, very good. When I think of the communities, to your point, there are the over 55 and very active
Correct.
um, communities. And then there are the assisted living facilities
Mhm. Yes.
where they might not, they may still be active, but because they need a little of assistance, it's probably
Mhm.
a lesser
Less
level,
frequent for sure.
right? I really love that you're telling our caregivers to, when you're doing your checks, your wellness checks on your loved ones, that is one of those areas. It's invasive, but the way we need to approach it is very delicately, very diplomatically, but very intentionally and um, assertively. So it's hard for the child to be,
Mhm.
saying and asking these things of the parent and all of
Right.
these things. And during this caregiving journey, the roles reverse, and we know that, right? As the older that senior gets, that it becomes more and more impactful and evident that the
Mhm.
roles have truly reversed.
Yes.
And although the roles have reversed, a lot of times our caregivers struggle with the roles reversing in their minds.
Mhm.
And that is even on the part of the parent who still views that their caregiver, their child, as a child,
Right. Yeah.
you know? And one of the things we have to do in my coaching programs that I talk about is we need to preserve their dignity
Mhm.
at all times, because we
Absolutely.
we are going into waters we've not been there before. There's not a playbook for this. I've talked about, we people prepare for having babies. If you're going to have a healthy baby, God willing, you got a 9-month start on preparing what this is going to be, and all of those things. Lots of times we find ourselves suddenly a caregiver, no prep. So we
Right.
start before the need is there, right?
Right.
Um,
I think it's just of significance to develop a communication style that works for both the caregiver and the the family member, the elderly woman, because you want it to exude, of course, respect and maintain the dignity, as you said, but also openly discuss, Mom, do we need to, let's go into the gynecologist to make sure everything is okay with your vagina. You mentioned that you had some itching for the last couple weeks. Has that resolved, and just delicately, but addressing
Mhm.
um, some of these concerns that they may not know should be a concern, or some of these issues that are developing into a concern or a medical issue. So the main thing is to not necessarily wait for that woman to say, "Hey, I've had this going on for 3 months,"
Mhm.
or do you smell me? Or, it's how it's approached that can be very impactful to the patient, to the elderly woman in particular. And as far as exams go, most gynecologists can maneuver with the exams, and maybe do some of the testing through the urine, through a vaginal swab that doesn't require a speculum. So that should not be the limiting factor. So to
Mhm.
just keep that in mind as a caregiver.
Excellent, excellent. And so, staying right there for a few minutes, what routine screenings should be done for a woman over 65? And is there a time frame in which a healthy woman who's had healthy test results throughout her adult life, is there a time frame when they're not needed as much, or um, depending on what that history has been, they should continue into, maybe octogenarians?
So I would tell you at this point, um, routine pap smear evaluations are done between age 21 and 65. And after 65, the recommendation is that they are no longer necessary. And now there are some criteria have to be met. So the last 3 pap smears prior to 65 need to be
Mhm.
normal, no history of gynecologic cancers like cervical, ovarian, uterine cancer, vaginal cancer.
Mhm.
Um, so there are several components that have to be in place to reach that 65 no more pap smears.
Okay.
But once you reach that point, and this is established by uh, gynecologic specialists to determine the frequency of cervical cancer, for example, which is why pap smears are done, um, to determine at what age are you aged out, so to speak.
Mhm.
Okay. Now, does that mean that you can't have a pap smear over age 65 if you wanted? No, that just means that there's not a coverage for it financially, meaning from Medicare or insurance companies, because of the guidelines already set by the specialist. And
Mhm.
I'm just using pap smears as an example, but mammograms exceed to 75. So there are age where you can opt out of some of these routine screenings. Now, that doesn't mean you don't go to the doctor after that point, but that means that those particular tests aren't necessary if the criteria has been met.
Mhm. Oh, this is such good information. Question: HPV, does that occur in seniors?
Yes, it can occur in any woman or man. Obviously, men do not have a cervix or vagina, so the manifestation and testing is not the same as for a woman. HPV, human papillomavirus in particular, is what HPV stands for. It is the virus that causes or can cause cervical cancer. And so testing at the time of a pap smear now includes HPV, whereas years prior it did not.
Mhm.
So again, those tests are done, within up until age 65. And if the HPV is negative and the negative pap smears, then additional testing of even HPV would not be necessary.
Mhm.
Um, HPV is considered almost like a precursor to cancer, because most cervical cancer stems from HPV. So if
Oh,
you've always been negative, then the likelihood of that type of cancer is lower.
okay. Ah, interesting. Okay. So let's say we have seniors who they're still married and their spouse is still alive and they are still enjoying each other,
Yes.
right? Versus, a woman who is, widowed or never married and maybe not necessarily not having incontinence issues. As we age and become postmenopausal, that vaginal dryness is going to occur at some levels, right?
Yes.
So the vaginal dryness, are women impacted by that only during intercourse where they feel it and it's uncomfortable or painful, or can vaginal dryness um, have symptoms and you're not sexually active, but you're just postmenopausal?
So, yes, women can have vaginal dryness due to vaginal atrophy at any age, primarily at menopause or postmenopausal. And the manifestation can vary. For some women, it is an indolent itch, just kind of here and there.
Mhm.
For other women, it can be more progressive. For other women, it can manifest more during intercourse. Um, so the the presentation can vary from woman to woman and definitely age to age. Every woman at 60 can have a different level of vaginal atrophy or vaginal dryness.
Mhm. Uh, so what I'm hearing from Dr. Elita is take your loved ones to the doctor. Like, don't be trying to figure this out on your own, because these discussions and conversations are difficult. They're difficult to have. And you as the caregiver, you might be okay asking your mom or the loved one that you're caring for, the elderly woman, but they might not be as forthcoming
Correct.
because of their age. Guys, we know this, that our older generations, they were so secretive, like
Mhm.
everybody's holding their mouth and you're like, why didn't you say something? Nobody's talking, everything, don't talk. So, you know, um, you might be okay. Again, you might be okay asking the questions, but you might not get the real answers. And
Yes.
that's challenging. And guys, I know there's a temptation to be like, okay, well, she didn't say anything, so I'm not going to do anything about it. Things
Right.
are changing. Remember that things are constantly changing, not necessarily for the bad, but they
Mhm.
are changing and they need a professional's lens on it. So please don't think that, well, she's not having sex, which if you're not with her 24 hours a day, according to
You
Dr.
don't know.
Elita, you don't know. Right? Number one. But just don't take the weight of this, because there are things that can be addressed, that won't develop into something if you just thought, oh, she's good, and let it go, right?
And so I oftentimes will I feel like this is synonymous with a teen, okay? Because, a teen doesn't necessarily say what's going on either until it's really bad.
Yeah.
So just think of yourself um, as a caregiver, having a conversation with your elderly family member and maybe just mentioning, I'd be glad to take you to see the gynecologist or my gynecologist who's great and who I'm comfortable with. And you can share with her if you're having any concerns. Or if you decide that, or if you notice something is changing, just
Mhm,
let me know and I can take you there. So there's that open invitation, but not necessarily I'm getting in your business
mhm,
scenario.
mhm,
Because sometimes it's a gentle conversation and not as aggressive that leads to an evaluation.
mhm, mhm. Yeah, yeah. No, I'm hearing that. Yeah, loud and clear. And even, do you think it might even be useful that maybe once a year or once every couple of years, unless and until that, an OBGYN such as yourself would say, kind of set the schedule, like, okay, she's fine, we probably won't need to see her if nothing changes, we probably don't need to see her for 2 or 3 years. Is that something that we could suggest to caregivers instead of them trying to determine when it's time to bring their loved one in?
Well, I certainly think that it should be up to the family, the caregiver, and the woman in particular,
Mhm,
because there's no set rules past 65 beyond the fact that you don't necessarily need to see a gynecologist unless you're having a problem.
mhm,
Now, I have several patients that um, don't necessarily need a rule, but want to have a yearly or every 2-year evaluation of their vagina and breast, or just vagina because their primary care doctor doesn't do that exam or doesn't feel it's necessary, but they feel comfortable with that. And I
mhm,
have women well into their 70s and even 80 that come in that don't necessarily have a problem, but just want it checked out because they are active.
mhm,
And we know as women age that there's prolapse of the pelvic organs. So maybe the bladder's falling, maybe the uterus is falling, maybe there's incontinence, whether with the stool versus bladder, urine. And so some of those women want to be more proactive and want to maintain their vagina. Now, different situation is when they're taking medication, like
mhm,
hormones in particular, they will need to be under a gynecologist care for routine maintenance of those medications, and that's pretty standard, I would say.
mhm. And you just talked to something I was thinking about, hormone replacement therapies. If a woman has had that prior to 65,
Mhm.
right? And I think I heard you say, as long as the last three pap smears and visits were good, everything was clear,
Mhm.
they should be fine. Does that apply for HRT as well?
So, hormone replacement therapy is a little bit different. So, in reference to pap smears and gynecologic care, up until 65, that type of testing is done. But if a woman is on hormone replacement therapy and they're over 60, they will need to be under a gynecologic care yearly. Um, because the risk of hormone replacement therapy outweigh the benefits traditionally after age 60. So they then met a threshold at that point that they need even more supervision per se for that
Mhm,
medication.
mhm, mhm,
So that's one thing. And then, of course, the evaluations that go along with the medications are pertinent at that
mhm,
point. So,
mhm,
and there's a variety of hormone replacement therapy, whether it's systemic, meaning throughout the body, like the patches and the oral tablets, versus vaginal estrogen, which is also requires monitoring with a gynecologist.
okay. Yes. All right. Great. I'm glad I asked that question. Um, UTIs.
Mhm,
Do you know, lots of times, women who are struggling with dementia,
mhm.
we found that UTIs exacerbate. the conditions, the symptoms, the behaviors, right? And so what can you tell us about preventing UTIs, or just trying to stay in front of those, because they do wreak havoc on that. The caregiver doesn't know what has happened, and literally it's like overnight the behaviors kind of get bizarre and frightening, right?
Right.
And then we find out this was just not just, but it
Mhm.
wasn't something like unheard of. It was a UTI.
Right. So I think that one component is whether um, the person, the woman is bedridden versus not. And the reason why I make that distinction is because a woman that is maybe bedridden and using some type of diaper or some type of padding to absorb the urine because of incontinence may not have the sensations and the discomfort as the urinary tract infection is developing. Okay.
Mhm.
Whereas someone that is more active typically will have some of the symptoms of burning on urination, maybe changes in the type of urine that they see in the toilet, maybe a color change, odor change. So these are maybe identifiers. So first, a conversation with the more active elderly woman. Hey, have you seen any of these changes? Make sure you let me know if you see any of those changes so we can go get it checked out kind of
Mhm.
immediately. Okay.
Mhm. Mhm.
Now, secondarily to that, postmenopausal women are more at risk for urinary tract infections simply because there is very little, substantially less estrogen at the vagina. The urethra, located near the vagina, then has less protection from the bacteria that are at the vagina. Okay. So it is an open door sensation
Mhm.
because that tissue that was supported by the estrogen is not present. So they're
Mhm.
more at risk for that bacteria just kind of moving up into the urethra. The
Mhm.
third factor is that the urethra itself is in a different anatomic location as a woman ages and goes through menopause. It then goes from being at the opening, near the opening of the vagina at the top, then moves kind of
Mhm.
posterior or inside the vagina a little bit. So, again, more bacteria exposure. Okay. And then you add the next factor, which is someone that may be not mobile, so then they're sitting in or not emptying their bladder maybe completely
Yeah.
or for long periods of time, and that bacteria sits in the bladder, in the urine,
Ah,
and again moves up to the kidneys.
wow.
So the bladder infection itself doesn't cause the um, mental status changes. It's when the bacteria moves to the kidneys and then into the bloodstream, and that is what causes the mental status changes.
Oh, wow.
So when it starts affecting the kidneys and other organs, that's how it gets involved. So
Mm.
it's more a little bit longer process,
Mhm.
but a lot of times it's not recognized until the
Right.
mental status changes. And so
Oh, wow.
I
Oh my
hope that
goodness.
was enough explanation
That
about that.
was really good. No, that was really good. I had never heard the explanation before. So helpful. What if a woman has had a hysterectomy? What
Mhm.
does her care look like after 65?
Not really much different at all.
Mhm.
Hysterectomy basically means that the uterus is not present. And so, with the uterus not present, then there is not a risk of uterine cancer, but overall care is not different. Whereas a woman that has her uterus, there's always a concern for uterine cancer. And if there's vaginal bleeding, it would need to be evaluated immediately. Without a uterus, that risk is not present, but
Mm.
overall care is not different.
Interesting. So again, I am just being informed here because there's so many things that we just don't know because we haven't gotten to those ages yet,
Right.
right? But as a caregiver for our moms and grandmothers, we need to steward them well. And this is what's going on or potentially could be going on with them. And so again, as we prepare, right? We prepare for this season, not only for them, but for ourselves. This has just been super informative, Dr. Elita. Do you know if there are any like groups, social groups or resources for these gynecological issues that maybe my caregivers can, plug into?
I think the ones that come to mind for me is are the websites, the sites that are specifically from gynecologists. So the American College of Obstetrics and Gynecology, or so ACOG, ACOG.org,
Mhm.
has a plethora of women's health information, some for elderly, but that discusses some of the hormone replacement, urinary tract infections. So I would always start there because it's just a plethora of information that is good. That is a good resource. And then secondarily, I would say North American Menopause Society, it's the older name now, the Menopause Society, again, specialists of gynecology, specifically for these women past menopause, since past the cessation or the ending of their period. Get a lot of patient information that is in layman terms and a plethora that could be beneficial. So I would start with those two for sure.
Oh, that is great. That is great. Well, you all, this has been Dr. Elita Wyckoff. And I wanted to ask you, is there anything you want to share with our listeners about some amazing work that you're doing? Any new innovations or new programs or projects that you're working on that you'd like to share?
Oh, not at this time. At this point, I am so actively practicing OBGYN and in the Triangle here in Cary, North Carolina, and I have been more focused on menopause as of this last year. So I'm delving deeper in that area. And then I always make reference to a book that I wrote with my sister, With Ease, Navigating the Medical Office Visit. And that's just kind of an easy read for anyone to make sure that they are getting the most out of their relationship with their doctor, obtaining the most information and best practices from their provider. So I think that is helpful for anyone at any age. So
Wonderful. Well, I'll be sure to drop those in the chat. Not in the chat, but in the link below. So guys, if you are looking for, are you even taking new patients at this point?
I am. I
You
am.
are. Okay,
Yeah.
wonderful. So we'll be sure to drop the link. So if you are looking for an amazing OBGYN, please connect with Dr. Wyckoff. And also, if you are caring for your mom and you want her to have a look over, take a,
Yes.
once over, you see, she has a heart for this. This is why I wanted her to come on. She has a heart for not only just women and women's health in this area, but seniors, and we don't really see that a lot. We don't really see, and I know it's not a big part of the practice, but it's an important part, right? And she can help us prepare for ourselves as well. So thank you, Dr. Wyckoff. And
Absolutely.
yeah, I'm sure everybody's going to enjoy this segment.
Thank you for having me.
And we'll see you next time.
Sounds good.